We'll be discussing about the nutritional care and toxicity. And the people are reflected as what they eat. The people are what they eat, right? Patient. How when you are in clinic, every other patient will ask, Doctor साहब मुझे खाना क्या है? Doctor साहब मैं क्या खा सकती हूँ? Doctor साहब मैं क्या नहीं खा सकती? So, this is the basic questions you need to answer to every patient. You don't ask every patient to eat anything you can have. But you have to restrict something to some patients and some other things to some other patients. So you need to know all these things. So nutritional care and toxicity is today's lecture and lecture topic, discussion topic, I better say, and it is very important. So the lecture objectives are, at the end of the lecture, the student should be able to define balanced diet. There are some very critical terms which you need to know very precisely, and those are balanced diet, what is nutrition, what is balanced nutrition or diet, and nutritional care process. So explain nutritional care process with respect to nutritional assessment, diagnosis, intervention, and then its management. Then describe nutritional toxicity and its consequences. So today's lecture is quite a short one, but it's very, very significant. No way. So definitions. Definitions are balanced diet. Diet. What is diet? Diet is the food you eat, right? And the other meaning of diet is the food you don't eat, right? Whether you are dieting or not dieting. So the diet is the food you eat. A balanced diet is the diet in which all the components of the diet are present to keep a person healthy. A diet consisting of a variety of different types of food and providing adequate amounts of nutrients necessary for health. Nutrition is actually the food component of the diet. Nutrition is the food, like vitamin is a type of nutrition, right? And it has to be present in the diet. Otherwise, you need to have a multivitamin tablet, right? So the process of providing or obtaining the food necessary for health is for health and growth is nutrition, right? Like in growing children, protein is the nutrition that is needed much more than the other nutritive elements. Balanced diet or nutrition is a diet consisting of proper quantities and proportions of food needed to maintain health and growth. Proper quantities and proportions. You don't need to have in growing children, I told you just not right now that the growing children need protein, but it's not that they need all of they need only protein. They need carbohydrates and lipid at the same time in proportions, in correct proportions, right? So it has to be balanced all the time. It has to be balanced. And nutritional care process. Nutritional care process is actually which is undertaken by the doctor or the nutritionist, right? It is the systemic approach to provide high quality nutrition care. At this point of time, I must say that most of the diseases, they are caused by our nutrition. Either we take much higher, much more, or we take much less, right? So the systemic approach to provide high quality nutrition care with most of the diseases can be cured by the nutrition as well, right? So this is today's topic, today's discussion is about all this. So nutritional care process, the NCP. NCP is the systemic approach, as I told you, it's the systemic approach to providing high quality nutrition care. The NCP consists of 4 distinct interrelated processes. Now, this time, just imagine you have a diabetic patient. Imagine you have a renal disorder patient. Imagine you have a cardiovascular disorder patient. You are so many students, I think there are 107 participants. You can think about any disease you need to think, and just you can think about the encephalopathies. You can think about the liver diseases. You can think about muscular diseases, any disease you want to know, and then think about yourself that what kind of nutrition they must have. You're in third year, you know all the metabolic processes, so you need to think it. Now, the nutritional care process is the systemic approach that consists of 4 distinct interrelated steps. 4 distinct, how you approach a patient and how will you manage the patient, whatever the patient you have thought of. Now, think about how will you approach it. You will do the nutritional assessment first. The step 1 is nutritional assessment. Second one is the diagnosis. You will diagnose what is actually the nutritional deficit in that, deficit or toxicity. Or what will be the nutritional intervention you will do with that patient. And finally, nutrition monitoring evaluation, right? For example, you just think about a phenylketonuria patient, a newborn who has born with the single gene defect, that is the phenylketonuria. Right? In phenylketonuria, just think about the biochemistry. The phenylketonuria is converted into tyrosine by phenylalanine hydroxylase, and tyrosine then forms the catecholamines. Tyrosine will form the thyroxine. Tyrosine will form the melatonin. There's so many things, right? So the first phenylalanine has to be converted into tyrosine, and the enzyme in this single gene defect, phenylalanine hydroxylase, is deficient. That is not functional. And phenylalanine cannot be converted into tyrosine, and then ahead of tyrosine, all the things cannot be converted. So this phenylalanine, excuse me, or the phenylalanine. So phenylalanine is not converted into tyrosine, and tyrosine will not be converted into further molecules. So the deficits will be of the tyrosine products. So if that patient, you assess that patient, that nutritional deficiency is that tyrosine is deficient. So, and phenylalanine is more, because phenylalanine is not being converted. So you will stop the phenylalanine from the food, from the milk, from the formula milk. You will provide the formula milk, which will be rich in tyrosine, right? So the tyrosine will make the products, and then these patients can be prevented. The mental deficit, mental retardation, that is the consequence of phenylketonuria, can be prevented by giving tyrosine. So this is you assess the patient, then you diagnose that what is more nutritional diagnosis, then nutritional intervention, and then monitoring whether your intervention is giving you the desired results or not. So these are the 4 steps of NCP. This is the first step. You acquire. How will you assess? How will you assess now? You will take the food and nutrition related history. Then you will check the anthropometric measures, obviously, the signs of malnutrition. Then biochemical data, medical test and procedure. For example, here I say that the patient is vitamin B12 deficient, for example. The patient is megaloblastic, right? Patient presents with megaloblastic anemia, pernicious anemia. You will differentiate it from the megaloblastic anemia and pernicious anemia by a biochemical test. So the biochemical data, medical test and procedure, you test that, and then you label that patient as pernicious anemia and not the megaloblastic anemia. If the megaloblastic anemia is there, then you have to you have to give the folic acid. If there is pernicious anemia, you have to give vitamin B12. So this is the difference. You will assess it by food and nutrition related history, then anthropometric measures, biochemical data and medical tests, Then nutrition focused physical findings and personal history. Now, what is the difference between food related history and personal history? For example, I gave you pernicious anemia example. Pernicious anemia, the patient will be unable to tell you that I am not taking vitamin B12, obviously, right? You need to know vitamin B12 is present in animal products like visceral fat, visceral meat, and red meat. So vitamin B12 is, if you take the history of your nutritional history, the patient may say that no, I take plenty of food, plenty of visceral food, right? Then how will you assess? You'll take the personal history, and in personal history, the person will say that, oh, I have acidity, I have very much of bleeding, GI bleeding. There may be ulcers, right? So in that case, we think of vitamin B12, right? So these are the this is the nutritional assessment process. I have given you the website. I'll show you the snapshots of assessment, diagnosis, all those at the end of the lecture. And I have given the website as well. You can check it from there. I have made the lecture from there. Now this nutritional diagnosis. In this, you make the diagnosis. You have assessed the patient, right? You have assessed the patient that intake of food is less or more. Which food is less? Which food is more? Then clinical, nutritional related medical or physical condition, right? And then behavioral environment, knowledge, attitude, belief, physical environment, access to food, and food safety. Some patients, they do have the access of the correct nutrition, but they don't take because of their beliefs. No, this will cause that, this will cause this will cause that. So these are the environments. This is called the behavioral environment, right? The knowledge, attitude, belief, physical environment, access to food, and food safety. When you have all these things, you create a PES. What is PES? It is actually the problem or nutritional diagnosis. You just write down the diagnosis there. Then etiology, what is the causes and risk factor, whether it is inborn disease, whether it is acquired disease, whether it is deficiency state, starvation state, whatever. You write the etiology over there, and then signs symptoms, the description of the patient's nutritional diagnosis. What are the symptoms of that nutritional diagnosis, right? So this is PES, you write that. And then step 3 is the selection of nutrition intervention. Then you select the intervention, and this is also a systematic approach. The food and nutrition, nutrient delivery, how will you give it? Parenteral, oral, whatever. You select that intervention. And then nutrition education, you give, if you find that nutrition is present in the environment, but the patient is not taking it because of some reason, you educate the patient and his or her family. Then nutrition counseling, you have to counsel because the whole family maybe, if there is a belief that this nutrition, it will cause something bad, the whole family will be affected of varying nature. Then coordination of nutrition care, and then population-based nutrition action. So we devised all that. This is the intervention. The selection of the nutrition intervention that will be directed to the root cause or etiology of the nutrition problem and aimed at alleviating the signs and symptoms of diagnosis, right? Then the fourth and final step is the assessment of your intervention, right? Whether it was good or not, you just do. Determination of making progress towards and achieving the planned goals. The food and nutrition related history outcomes. You have taken the history in the beginning, in the assessment, and you know what are the signs symptoms. Now the signs symptoms are actually being alleviated or not. Anthropometric measures you have taken in the assessment, now take it more again. whether it is coming back to the normal or not, biochemical data, medical test and procedure outcome, and nutrition-focused physical finding outcomes, right? So these are the outcomes, these are the monitoring or evaluation of your intervention in the NCP, right? This is very, this is not very much difficult. If you want to do it, you can do it because you are doing it in daily life, right? For example, in renal disease, you ask the patient, do not take plenty of proteins, right? Because uric acid will be more, right? And uric acid will cause uremia. So you ask the patient not to take much of the proteins. You ask in liver disease, again, you will ask the patient not to take much of the proteins because it will cause encephalopathy, right? So you are taught of these things. This is only the systematic record of the nutritional process, and this is how you can provide a much systematic or much significant nutritional care to your patients. Then about the nutritional toxicity, if you know that everything is toxic, even water is toxic, I better say yes, I would say water is toxic. If you take large amount of water, it will not do much of the good to your body, right? If you take less water, you know it will cause dehydration. So less and more, both are nutritional deficits. Nutritional deficit is the less nutrition. The malnutrition is less nutrition, leading to the cachexic patients, less BMI, and malnutrition is also the obesity. Obesity leading to hypertension, leading to cardiovascular diseases, leading to diabetes, leading to so many of diseases. Polycystic ovary disease. So the obesity is also a malnutrition, and you need to treat obesity as the nutritional deficit as well, right? So the proper nutrient should be taken, proportional and desired amount. Even a keto diet, which is very common these days and very popular these days, is not good, right? So the excess water, glucose, proteins, fats, vitamin C, these are all the very nutrients you must have in your diet. But excess of these will cause problem, right? Excess of glucose, more blood sugar level, excess of proteins, more uric acid, excess of fats, obesity, excess of vitamins, vitamin toxicity, and deficiency, water, glucose, protein, fats again. But you can reduce yourself. You are third year students. You can reduce yourself by 2%, right? So your problem is partly genetic and partly a Boston cream pie. So the junk food, which are very popular these days, are also not good, right? Although they are very much palatable, very much delicious, but they are toxic. They are toxic nutrients. This is the food toxicity, nutritional toxicity, and I have given you this website as well, where you can check those toxicity. We'll see these slides now. So thank you, and now new slide share. These are the nutritional assessment. I have given you the website from where I have taken it. They have elaborated things. You can see the use of nutritional assessment is the or indicators are compared to the reference standards, recommendations, or goals These norms and standards may be nutritional, national, institutional, or regulatory. According to our the BMI, which is according to our population, Asian population, nutritional assessment findings are communicated in nutritional diagnosis, problem statement, and nutritional intervention goal settings. So critical thinking skills are determining important and relevant data to collect, determining the need for additional information, selecting assessment tools and procedures that match the situation, applying assessment tools in valid and reliable ways, and validating data. Nutritional diagnosis is the in this critical thinking skills, right? PES, right? Can the nutrition and dietetics practitioner resolve or improve the clinical nutrition diagnosis? You can think finding pattern and relationship among the data and possible causes, making inferences, stating each problem clearly and singularity, like that. Nutritional intervention, setting goals and prioritizing, making interdisciplinary action, defining the nutritional prescription or basic plan, initiating behavioral and other nutritional interventions. I have given you all that, right? I have given you all that. And see the appendix. I have given you this as well. In this, the nutrients are given: protein, carbohydrate, fats, vitamins, each of the vitamins, right? And the micronutrients, macro and nutrients, the elements as well. And these are the toxicity symptoms, deficiency symptoms and toxicity symptoms are also given. So you can go through this chart. This is very easy and very, easily understandable chart. So major food sources are also given. So with this, I just stop here and ask you if there is some question. Zainullah, very good. Celiac disease. Tell me, what are the problems? What are the nutrients should be given and what are the nutrients should not be given? Now you think about the disease and search the internet, search Google, and you just form your own NCP. Very good, gluten-free diet. Very good, very good. So you know all that. Just make a chart, make NCP of that disease, of that one disease. This is your homework. This is your homework. Practice for only one disease, and you can understand all of the process. Shabash, very good. What problem can be caused by this? Think about one disease yourself and make your own NCP. This is the, very good exercise. Every disease you can think of has the nutritional problem. Any disease you name it, you name any disease has the nutritional problem. Even with flu, for example, people say take vitamin C. This is a nutrient. Come on, right? So just make your own. In iron deficiency anemia, dates and pomegranates are recommended. What other food should be recommended? Tell me. You tell me now. Zainullah, very good. Zainullah, search for iron-rich food and give it to the patient. Now, I give you the questions to think about. For example, the patient with diabetes, if I give honey, not the brown sugar, not the white sugar, but use honey, what should be the consequence? honey instead of brown sugar and white sugar given to diabetic people. Honey is good. Why, Zanullah? Why blood sugar doesn't rise, Osama? Very good. Because it is facilitated in absorption. Why? Why? What the honey has? Fructose. Very nice. Muhammad Shamil. Fructose. Because fructose doesn't need insulin to enter into the cell and it directly enters into glycolysis. Very nice. So just make the NCP of a diabetic patient with cardiovascular complication, with renal complication separately. Diabetic with no complication, type 1 diabetic, make these NCPs and you will enjoy it. Most of the diseases can be cured by nutritional interventions. Right? I give you an example. You know what? Our Prophet ﷺ asked to cook talbina when there was a sick. When there was a sick, the classification of sick is not there. The determination, description of sick is not there. Just sick, any mareez, right? The cooked talbina. Talbina used to have jaw, barley, and then honey and dates and milk. Barley cooked in slowly cooked in milk and dates, and it is given to the sick, either mixed with honey or not. Right? So, what are the uses of barley? What are the benefits of barley? What are the benefits of dates, except for myelin? There's so many things, so many. Any other question? So thank you very much, my students.
Yeah.
Ji. What, Azanullah, what are the importance of lassi? Okay, tell me. Tell me, you tell me. It is salty or sweet. It has water. It has yogurt. It has no lactose. It will not irritate GIT. Maybe, I don't know. Tell me. Zanullah, tell me. It is over to you now. You think and make the NCP of your disease of interest, right? Thank you, students.